Did you know that 7 out of 10 Americans who have medical bills say that they have to lower their spending on food in order to avoid a medical bankruptcy? Navigating our highly complex world of healthcare and health benefits leaves many people feeling like a snowball in, well, you know where. I'm Josh Butler, healthcare consultant and advisor to more than 150 employers around the country, and this is A Snowball's Chance in Healthcare, a show about restoring hope in healthcare. Join us as we discuss ways you can lower your healthcare and benefits costs, how companies are winning the healthcare and benefits battle, and how hope is being restored to this community and communities across the country. Hello again, and welcome back to A Snowball's Chance in Healthcare. My name is Josh Butler. I am a healthcare consultant and broker in Amarillo, Texas. I'm the president of Butler Benefits and Consulting. And each and every week, we are talking to employers, or we're sharing stories and we're sharing tactics about, giving people hope in healthcare. So many people get frustrated with our status quo healthcare system, with the prices that we all pay. And this week, I'm extremely excited to once again have a guest on this program. Dave Chase is the co-founder, and he's a mentor to so many people, including myself. He's the co-founder of the Health Rosetta. Welcome to the program, Dave.
Josh, looking forward to chatting. Thanks for having me on.
Absolutely. Another thing, I want to put up a plug here. This was Dave's, actually, it was your second book. I learned that. That was one of the trivia questions at the conference when they said, what was Dave's first book? And I was like, it's the CEO's Guide. But it actually wasn't. But many people in this community, I've shared this book with you. It's a book that really kind of changed the trajectory of my career and my business over at Butler Benefits. And Dave is the author of that book. And we can talk about the book a little bit. But a couple of episodes ago, Dave, I mentioned to the audience and had a guest on that we just recently had a summit where a healthcare summit with the Health Rosetta. But first, tell the audience a little bit about what is the Health Rosetta? What is it? What are you doing with that?
Good question. It's really trying to get at this big picture problem at the highest level. It's sad to say, but many people, for understandable reasons, have lost hope in America because of healthcare. Not that they know directly, but they've lost hope because of the collateral damage from healthcare and the fact that it has induced severe financial stress for 30 years for more than half the workforce, the working and middle class. It's the number one driver, and has been for a couple decades at least, of inflation, debt, poverty, and bankruptcy. And people have no ability to save for retirement. And, there's a bunch of other pieces of collateral damage we could get into, but I think that's enough right there. And fortunately, there are people like you who are showing there is a different way, and there is actually an opportunity for hope. And, for a while, kind of tongue in cheek, I put in my LinkedIn profile as my sub-headline, hope merchant, because somebody said I was a merchant of hope. And that was the first time they'd had any hope about healthcare. And fortunately, there's reason for that hope and a lot of evidence now. So that's the big piece, is how do you get health plans to do what they're intended to do, which is to promote and restore health. And that seems kind of basic, but we have come up with this blueprint that, with that book you shared, The CEO's Guide to Restoring the American Dream, the sub title to that was How to Deliver World-Class Healthcare to Your Employees at Half the Cost, which almost can sound like some goofy infomercial, but it's actually happening. I found those people were doing it. And the idea with the book was, if I shared that, other people around the country would do that. And 5 years later, we have a follow-on book, which is The CEOs Who Restored the American Dream. And we had to stop at 100 pages of success stories of people doing that. So it's not just some aspiration or some exception. There's people doing it in every corner of the country, in rural and urban settings, public and private sector employers, large and small.
Well, I mean, what do you say to people? You're a madman. How can you deliver world-class healthcare at half the cost? And that's really the work that we're all embarking on within the Health Rosetta. But it's not just a community of brokers and consultants, is it, Dave? Who else is in this? Who are the other bought in, sold out stakeholders within this ecosystem called Health Rosetta?
Yeah, I mean, focusing on the positive part of it, the clinicians are so vital, right? We can't do it. Neither you or I are clinicians, right? And the three things that we've come to understand that most people don't understand yet is healthcare is fixed/fixable. Like all the solutions to fix healthcare have already been invented, proven, and moderately replicated. Healthcare is not expensive. People are like, what? How can you say that? Well, clinicians only get 27 cents of every dollar that we ostensibly spend on healthcare. What's expensive is profiteering, price gouging, administrative bloat, fraud, and some inappropriate care. If you choose not to pay for that, healthcare is not expensive at all. And finally, the other thing that we understand that a lot of people don't yet is we're already investing more than enough money to not only fund a world-class healthcare system, but because we're currently wasting $1.5 trillion in the US healthcare system, which is well documented by PwC and the National Academy of Medicine, that would be the 11th largest economy in the world, what we waste.
Amazing.
Larger than the entire Russian economy. And so when you don't waste the money, you can fund or restore funding to things that are actually a bigger driver of health than the sick care system or the healthcare system. It's kind of common sense once you think about it. Actually, the number one driver of health in America, probably the world, is income. Number one, income. And so, of course, stealing 20, 30 years of income gains for the working middle class that the healthcare has done doesn't help that. And then other things like education, housing, right? These are the things that actually have a bigger impact on well-being. And sadly, the old line plans have stolen away from that. So we just stopped that heist and put that hard-earned money back into Americans' pockets where they can best achieve their hopes and goals.
Absolutely. And just a moment ago, you mentioned our sick care system. Well, that's what you like to call it, our sick care. It's our current state of affairs in our current healthcare system. And you rattled off several, of the bigger issues that we talk about a lot, even on this program. But from your perspective, I've watched a lot of your podcasts and I've watched a ton of your interviews. I've learned a lot from you on a continuing basis. And I know that a lot of people that have interviewed have asked this question: is our healthcare system really broken, or is it running exactly the way it was intended? Now, I'm not going to ask you that question, Dave, because you've been asked that question a dozen times. But here's what I will ask you. From your perspective, because I know your sentiments on that. I've heard you answer that question many times. What's the most broken aspect of our current sick care system, of our current healthcare system, that you feel needs to be fixed?
Well, I would say there's many things to be fixed, but at the core, and why the tip of the spear for our movement has been people in your role, right? I wrote a piece 7 years ago, well before I started Health Rosetta, that said this job could save America. And at their best, benefits brokers, benefit advisors, I believe it's the most underestimated role in the entire healthcare system, probably in the US economy. And the incentives that have existed and the lack of disclosure on how people get paid. There's a school district that's suing one of the big brokerage houses. And they were told that brokerage house was going to earn $190,000 for the work they did, which is fair, right? There's a lot of work, no problem with that. Problem was they actually earned over $2 million on that. Yeah. And so it's actually the tip of the spear that as you address that, it unpacks all these other cascading set of misaligned interests, perverse incentives. And when you do that, you solve it. And at the core, there has been a law in place, believe it or not, since the Ford administration that I know you're aware of, for the healthcare wonks, it's ERISA. It's like the employee retirement, whatever. Basically,
Income
it came out of the
Security Act.
EDSOL.
Yeah.
Income Security Act. Yeah. And it came out of the EDSOL bankruptcy when the pension EDSOL employees was all in EDSOL stock, and they lost their pensions. And so they set that. And we can go down that rabbit hole, but basically it says that an employer has to have apply what is one of the highest duties under the law, what's called fiduciary duty. When you are stewarding somebody else's money, that is a very high standard. And unfortunately, it hasn't been enforced in a significant way until very recently. There's been a big change in the last 6-9 months, and it's long overdue. Basically, the same thing happened in retirement benefits 10 or 15 years ago, and it has saved billions for American households because they got the retirement side right. Now it's time to get the healthcare side right.
Yeah, now I had a question written down about that for you, but since you're bringing it up, let's go ahead and skip to that. We talked a couple of episodes ago, and I mentioned it probably at least in every single episode here on A Snowball's Chance in Healthcare, about the newly passed piece of legislation called the Consolidated Appropriations Act, the CAA, and I talk about it quite a bit. Now, I know that you've written extensively about the CAA, but honestly, how disruptive do you believe that the CAA is going to be? And on two levels, answer it on two levels. How disruptive is it going to be for employer groups? And how disruptive is it going to be for those clinicians in the healthcare world, the hospitals and the insurance companies, not just for employers, because there's a lot that's going to affect them, but on the other side of the equation, insurance companies, TPAs, hospitals, doctors, how disruptive is it going to be, Dave?
Well, you've probably heard me say this before. I always have a bit of an issue with calling restoring the American dream and making things rational disruptive. It's a change. To me, the status quo is what's radically disruptive.
Amen.
And so this is one of the instances where applying a regulation, right, for an employer has this incredible opportunity to not only put money back into an employee's pocket, and it is their money, that's the way the law is written, but the bottom line impact is unreal. You have like a Pacific Steel and Recycling, right, that was they're about a 700-person company 5 years ago. We're spending over $8 million in healthcare. We're projected to be spending about $10 million by today. And the last 2 years, despite last year really having a rough year claims-wise, they spent less than $3.5 million, while benefits dramatically improved. And by that, I mean like cost sharing removed for members. And that's remarkable. If you talk to the CFO, they would have had to increase top line sales revenue for that company, a mature manufacturer, 25 to 30%. So yes, there is change when things get rationalized. And to me, I think of it as a restoration versus a disruption. And so, but the impact is profound. It is the biggest change in employee health benefits since 1943. And that's a big statement. It's fact-based. And given that healthcare or employee-based healthcare is about half of Americans get their care that way, it's probably about 2/3 of industry profits. When you change that, for sure, there's going to be organizations that are big winners in that and some losers in that. So it just depends on whether you're on the side of patients and the side of the American dream or not.
Absolutely. And I just did an exercise. I conducted it and wrapped it up about a couple of weeks ago. And I've kind of converted this into a call to action for our community leaders, people like our mayor and our city manager and, our county government and our school districts and our economic development corporations. When you're talking about the overall impact it can have on communities, I did the math just on our current book of business at Butler Benefits, and we have employers that are still in a very traditional model. They're buying, insurance, like from a Blue Cross Blue Shield of the world, and that's fine. I mean, there's always going to be a place for that. And there's always going to be companies who don't fit a model perfectly. But then we have some other subset of employers that have transitioned over to these more flexible, these more customized self-funded health plans. And they're generating on average, Dave, around $2,890 per employee per year less in healthcare utilization than folks that are in these more traditional plans. Well, I did a little research for Amarillo, and this is the message I shared with our community. And maybe you can expand, this conversation a little bit as well. There's 130,000 people in the Amarillo workforce. And if every employer in Amarillo adopted health plans that reduced their overall healthcare expenditures by around $3,000 a year, just right here in my hometown, Dave, it would generate anywhere between $380 million and $405 million a year in economic stimulus right here in a pretty small town. Amarillo's only got, a little over 200,000 people in this community. But are you seeing things like that take more root in other communities around the country? And if so, give us a couple of examples.
Yes. And I would just amplify your point a little bit in that not only is that the stimulus, a lot of that is money that's extracted out of your local economy, right? So it is kind of shop local comes back to healthcare. So there's out-of-town carriers and PBMs and health systems that are extracting money out of your local economy. So that's not to be underestimated as well. But in terms of around the country, yes, there are 10 communities that we're tracking particularly closely, and we have some involvement in some of them. Places like Northeast Ohio, where it started with private sector employers like auto dealers, manufacturers, chemical companies, and then it went to the public sector, the county, then the school district, and now the city in that area. And it's remarkable, right? This is a community that's been hit hard, right, by offshoring and outsourcing and, kind of your stereotypical Rust Belt community. And just to give one example, the superintendent, speaking of our Denver summit, of that school district,
it was a great speech
and spoke. Yeah, unbelievable, right?
Unbelievable.
This health plan, had it not been in place when the school levy had failed, which didn't very often, despite the fact that the 8th poorest county in their state or school district in their state, they'd supported their schools, but they can only do that so long given the tough economy. And fortunately, even though that had failed, they'd saved more in health benefits while healthcare benefits dramatically improved, better primary care, removing out-of-pocket costs for surgeries and medications and that sort of thing. It saved more money the entire school levy, and that was so impactful that they didn't have to cut teachers' programs, pay
right.
potentially a school, that superintendent has, despite the fact that that's quite an achievement professionally to become a school superintendent, he's retiring as we speak to join our movement, to take it to begin with 600 other school districts in Ohio and then beyond. That's the type of human impact that happens when you do that. It's almost beyond belief, and that's why, it's like, hey, here's the case studies. Here's 100 pages. You want more? We got more. But, hopefully 100 pages, gives you a good sense that this isn't just some fluke. The case of like Rosen Hotels, again, a huge impact on their community. They've been doing it 30 years. They've cumulatively saved over $500 million. One employer.
I know
that is not a fluke.
No, it's not. And man, I really, really loved that hearing that superintendent tell their story and the success that they were able to achieve. And what you're talking about up in Ohio, I can't wait to have our friend and colleague Bryce Heinbaugh on the show, because he's right in the middle of all that, and he's doing amazing things, things that you wouldn't expect brokers and consultants and advisors to be doing. And that's why we even say here we do a lot more than sell insurance. We're building things at the community level in conjunction with partners like the Health Rosetta. And so let's transition, because we got a few more minutes here, Dave. We've got about 5 or 6 minutes here, but plenty of time to answer another question. Is we talk a lot about the problems and the issues that we're in the challenges that we're trying to overcome in this industry. And you see a lot of innovation in this space. I know you do, because you put it on display at these summits, like we had in Denver a couple of weeks ago. But, of all of the things that you see, what's the most exciting, or maybe what's the most promising healthcare solutions that you're seeing out there, or that you've seen over the last couple of years, that you say, man, that right there, we've got to double down, triple down, quadruple down on this vein or this area right here? Where do you see the area for most promise for improvement?
Yeah, I mean, it actually underpins a number of the examples we've already talked about. And at some level, it seems like so boring and basic, but sometimes boring and basic is rare. And unfortunately, in our country, we've systematically destroyed primary care over the last 20, 30 years. And when you see, I know you've personally experienced a remarkable impact of proper primary care.
Yeah.
And when you have proper primary care, it depends on it's fully actualized. Between 80 and 90% of all the issues people enter the healthcare system for can be fully addressed in a proper primary care setting. That's not the norm for most people in the US, right? It's just become a loss leader, milk in the back of the store. It's a sad state of affairs, that some great PCPs are just turned into kind of glorified billing clerks, when that's not why they were called to that profession. And when you do that, you keep people healthy, you keep them out of harm's way. You only hospitalize when you absolutely have to. And when you do, or somebody needs a surgery, you're ensuring they're getting to the absolute best place. And kind of the sort of co-pilot that's exciting, that certainly Bryce Heimbach is an example of this nurse navigator, kind of nurse concierge that is kind of your Sherpa as you're navigating this treacherous terrain. It's scary, when you have a serious diagnosis, and to have somebody that's on your side, that's not conflicted. It is just a beautiful thing in terms of what it means for people. And so it's kind of basic, but sometimes back to the basics is what it's all about.
Yeah, absolutely. And I think that's what you mean by, utilizing terms like relocalizing healthcare. I know that when we started to have more local conversations with clinicians and nursing groups and pharmacies and imaging centers and surgery centers, that, things started to really tighten up and come into focus for us about how, so when employers ask you the question, how on earth can you deliver world-class benefits to employees at half the cost? Employers can't wrap their head around that. Most of them can't, because they have no idea. They don't get to negotiate their healthcare costs now. So there's a lot of X's and O's that come into these plans that we call community-owned health plans. And to me, for me, I'll answer my own question. And I love your answer too, because it's 100% true. We need to double down on this investment into the right kind of value-based primary care in our communities. But at the end of the day, employers, because 55% of the country still accesses our healthcare system via an employer-sponsored health plan, is that we're designing health plans that can actually leverage the relationships that we're developing at a local level. And to me, that's the beautiful part of what Health Rosetta is building out and iterating out, that is replicable from community to community.
Yeah, and one way of looking at it is without really consciously thinking about it, we've let our communities be colonized by Wall Street. And what we're doing is kind of reestablishing sovereignty over our health, right? That you look at where health starts, right? Where does health start? Doesn't start in a pill, doesn't start in a hospital. It starts at home, mom and dad, and then you have concentric circles out there, your neighborhood, your community. That's actually where health is most impacted. And so it's fantastic to see communities sort of reestablish sort of a sovereignty rather than being a colony, basically, for some folks who are doing perfectly rational things against a set of irrational and perverse incentives. But that's our job to get it right. They're going to continue doing what they do as long as we allow them to.
That's right. I love it, Dave. Well, I could go on and talk about this for hours and hours, but unfortunately, we're running up against our clock. We got a little time left. I just want to say thank you so much for not just coming on this program of mine, but also for your books, for your inspiration, for the movement that you're leading through the Health Rosetta. It's a national movement, and it is starting to spread to many, many markets across the United States. If you haven't read the CEO's Guide of Restoring the American Dream, if you reach out to me, I'll give you a free copy of it. It's a tremendous book. It changed my career. And Dave, thank you again so much. God bless you. And I look forward to seeing you again at our next summit.
Thanks so much. And if you weren't helping make it happen on the ground, I'm just a crazy guy yelling at the internet. So thanks
That's
for making
true.
it happen.
There's lots of people that think we're all crazy, but we're not, and we're making big waves and big impacts. And it really did, for me at least. It started with you. So, ladies and gentlemen, that's going to do it for another episode of A Snowball's Chance in Healthcare. God bless and enjoy the rest of your weekend.